Department of Health, we've been planning our vaccination phases using guidance from national organizations and our vaccine subcommittee. I'll ask if we can put that slide up on the screen, please. So as you can see in our current plans, high-risk healthcare workers, such as those in hospitals, long-term care facility residents, and first responders will be the first people to be vaccinated in Phase 1A. Those are the people that we feel are most at risk and can benefit most from the vaccine. Our hospital workers will be vaccinated at hospitals. We've been working closely with our hospital systems here in Rhode Island. Long-term care facility residents and staff will be vaccinated at their facilities through a partnership we have established with CVS and Walgreens. And those logistics are being worked out as we speak. Other Phase 1A people, such as first responders, will be vaccinated through 5 regional clinics that will be held throughout Rhode Island. And during the first few weeks, we anticipate that between 10,000 to 20,000 doses per week will be administered. After that, we expect that we'll be receiving roughly 32,000 doses of a vaccine each week, and that breaks down to 8,000 doses of the Pfizer vaccine, 8,000 second doses of the Pfizer vaccine, 8,000 first doses of the Moderna vaccine, and 8,000 second doses of the Moderna vaccine. And by second doses, what I mean is that both of these vaccines, both the Pfizer and the Moderna, are 2 shots, both 3 to 4 weeks apart. And so we have to reserve some of that supply, of course, for the second dose in people that got the first dose. As the vaccine comes into the state, we will eventually be able to open vaccine up to additional groups. And these include phases 1B, phase 2, phase 3, and then finally everyone else in phase 4. People in Phase 1B are likely to include, will include people with more than one significant health condition, so people that are most at risk from complications, hospitalizations, and deaths, and older adults in other congregate care or more crowded settings. Phase 2 is going to include all older adults not yet vaccinated, K through 12 teachers, school staff, child care workers, critical workers in high-risk settings, people with more moderate health conditions, and people in homeless shelters and group homes, and incarcerated or detained people and staff in those settings. So those are all groups that we believe are in higher risk of COVID-19 and associated complications. Phase 3 is going to be for young adults, children, workers in critical industries. An example of critical industries, for example, is the food system people who work in grocery stores, and they are planning on being eligible for the vaccine. And then finally, in Phase 4, everyone else who has not received the vaccine yet will be eligible. While these dates are subject to change, and I just want to encourage people to be flexible and patient as we roll this out, we do anticipate Phase 1 vaccination between December and February. So it's right upon us. So Phase 1 vaccination between December and February. Phase 2, we anticipate vaccination between February and April, and Phase 3 vaccination between April and June. So good news, by the summer, we anticipate that the majority of Phase 1 through 3 should be vaccinated here in the state of Rhode Island. So again, really fantastic news.